If you or someone you love is taking amlodipines, losartan, or lisinopril for blood pressure, I want you to stop whatever you're doing for the next few minutes and really listen, because what I'm about to share could be the difference between feeling good on this medication and silently suffering through side effects you didn't even know were connected to your pills. Millions of seniors around the world take one of these three medications every single day. They are some of the most commonly prescribed blood pressure drugs on the planet, trusted by doctors, recommended by cardiologists, and taken faithfully by people who just want to protect their heart and live a long, healthy life. But here's the problem. Most people are handed a prescription, told to take one pill a day, and sent home with almost no real explanation of what's actually happening inside their body, what warning signs to watch for, or what simple habits could make this medication work so much better for them. So today we're going to fix that. We're going to walk through what many seniors are never told about amlodipine, losartan, and lisinopril, the subtle side effects that get dismissed as just getting older, the dangerous interactions hiding in your medicine cabinet, and the everyday mistakes that could be working against the very medication that's supposed to be protecting you. This is not about scaring you away from your medication. Blood pressure control saves lives, prevents strokes, protects your kidneys, and keeps your heart strong. This is about making sure you understand the full picture so you can work with your medication instead of being caught off guard by it. Let's start with the basics, because understanding why these three medications are so commonly prescribed together or interchangeably helps everything else make sense. Amlodipine belongs to a class of drugs called calcium channel blockers. It works by relaxing and widening your blood vessels, making it easier for blood to flow through them, which lowers the pressure on your artery walls. Losartan belongs to a class called angiotensin receptor blockers, often shortened to ARBs. It works differently, by blocking a hormone called angiotensin II from narrowing your blood vessels in the first place. And lisinopril belongs to a class called ACE inhibitors, which stop your body from producing as much of that same angiotensin hormone to begin with. Three different mechanisms, three different pathways, but all aiming for the same goal, keeping your blood pressure in a safe range so your heart, brain, and kidneys don't take on unnecessary damage over time. Doctors often choose one of these based on your other health conditions, your kidney function, your age, your ethnicity, and how your body responds. Sometimes people are even prescribed two of these together. But because they work so differently, they also come with very different side effects. And this is exactly where so many seniors get caught off guard. Let's talk about amlodipine first, because this one has a side effect that catches almost everyone off guard at some point. Many people on amlodipine start to notice swelling in their ankles, feet, or lower legs after a few weeks or months of taking it. This swelling, known as peripheral edema, happens because amlodipine relaxes the blood vessels unevenly, allowing more fluid to leak into the surrounding tissue in your lower body. Here's what almost nobody tells seniors. This swelling is not a sign that you're retaining too much salt, and in most cases, it has nothing to do with your heart failing or your kidneys struggling. It is simply a known mechanical effect of how this particular drug works. Yet so many people see their ankles puffing up, panic, assume it's a heart problem, and either stop taking their medication on their own or rush to add a water pill without ever telling their doctor what's really going on. The right move is always to mention it to your doctor, because sometimes the dose can be adjusted, or split into a different timing, or in some cases, switch to another medication entirely if the swelling becomes uncomfortable. Another thing rarely mentioned about amlodipine is its interaction with grapefruit. Grapefruit and grapefruit juice can interfere with how your liver breaks down this medication, causing the drug to build up in your bloodstream at higher levels than intended. For some people, this means a much stronger blood pressure drop than expected, leading to dizziness or fainting. If you enjoy grapefruit in the morning the same way you take your pill, this is something your doctor absolutely needs to know about. And one more often overlooked detail, amlodipine can sometimes cause swelling or tenderness of the gums. It sounds strange, but dentists see this far more often than most patients realize, and it's frequently mistaken for a dental problem rather than a medication side effect. Now let's move to losartan, because this medication carries a very specific risk that quietly affects kidney health and potassium levels, and it's something seniors especially need to understand. Losartan works by blocking the hormone that narrows blood vessels, but that same hormone pathway also plays a role in how your kidneys manage potassium. Because of this, losartan can sometimes cause potassium levels in your blood to rise higher than normal, a condition called hyperkalemia. Mild increases often cause no symptoms at all, which is exactly why this is so dangerous if it's never checked. In more significant cases, high potassium can lead to muscle weakness, an irregular heartbeat, or in serious situations, a dangerous disruption to your heart's rhythm. This is precisely why your doctor should be ordering regular blood tests after you start losartan and periodically afterward to track both your kidney function and your potassium levels. Many seniors don't realize that something as simple as switching to a salt substitute at the grocery store can quietly work against them here, because most salt substitutes replace sodium with potassium chloride. If you're on losartan and using a potassium-based salt substitute without your doctor's knowledge, you could unknowingly be pushing your potassium even higher. The same caution applies to potassium supplements or heart-healthy supplements that boost potassium content, which sound helpful but can become risky in combination with this medication. Another piece of the puzzle many people are never told is that losartan, like other medications in its class, requires extra caution during periods of dehydration, vomiting, or diarrhea, because dehydration can cause kidney function to dip suddenly while you're on this medication, sometimes leading to a temporary but serious decline in kidney performance. Now, let's talk about Lisinopril, because this one has a side effect so well known among doctors, yet so often confusing to patients that it deserves its own spotlight. The dry, persistent, tickly cough. Somewhere between 5 and 20% of people taking lisinopril and other ACE inhibitors develop this cough, and it can start days, weeks, or even months after beginning the medication. It is not caused by an infection. It is not caused by allergies. It happens because ACE inhibitors affect a substance in your lungs and airways called bradykinin, causing irritation that triggers a chronic dry cough. Here's the part that frustrates doctors the most. Many seniors experience this cough, assume it's just a cold that won't go away, treat it with cough syrup or cold medicine for months, and never once connect it back to their blood pressure pill. If you've had a persistent dry cough since starting lisinopril, please bring this up with your doctor, because in many cases, simply switching to a different class of medication, often an ARB like losartan, resolves the cough completely within days. But there's something far more serious connected to lisinopril that every single person taking it needs to know, and that is angioedema. This is a rare but potentially life-threatening allergic type reaction where the face, lips, tongue, or throat can suddenly swell. It can happen at any point while taking the medication, even after years of taking it with no problems at all. If you ever notice sudden swelling of your face, lips, tongue, or throat, difficulty breathing, or difficulty swallowing while taking lisinopril, this is a medical emergency and you need to seek immediate medical attention, not wait for your next scheduled appointment. This reaction is uncommon, but it is precisely the kind of thing that should never be discovered the hard way without knowing it's a possibility in the first place. Now here's something that connects all three of these medications, regardless of which one you're taking, and it might be the single most important thing in this entire video, for seniors specifically, and that is the risk of orthostatic hypotension. This is a sudden drop in blood pressure that happens when you stand up too quickly from sitting or lying down. All three of these medications lower your blood pressure, which is the entire point, but that same blood pressure lowering effect can sometimes overshoot for a moment when you change positions suddenly. Younger people often barely notice this. Seniors, however, are far more vulnerable to it, and the consequences can be severe. This momentary drop in blood pressure when standing is one of the leading hidden causes of dizziness, lightheadedness, and falls in older adults taking blood pressure medication. And falls in seniors are not a small thing. A fall caused by a brief dizzy spell while standing up from a chair or getting out of bed can lead to a hip fracture, a head injury, or a hospital stay that changes the entire trajectory of someone's independence and quality of life. The simple, practical fix that almost nobody explains clearly is this. When you get up from sitting or lying down, do it slowly and in stages. Sit on the edge of the bed for a moment before standing. Stand up and pause, holding on to something stable before you start walking. Give your body a few seconds to adjust your blood pressure to the new position before you move. This single habit, done consistently, prevents an enormous number of falls in people taking these medications, and yet it's rarely explained during a rush doctor's appointment. Let's talk about something else that quietly works against these medications, and that's other drugs and supplements that interfere with how well they control your blood pressure. Over-the-counter pain relievers like ibuprofen and naproxen, commonly known by brand names many people have in their medicine cabinet, can actually raise blood pressure and reduce the effectiveness of amlodipine, Losartan, and Lisinopril when taken regularly. A senior who takes one of these pain relievers daily for arthritis or chronic pain, without realizing it's working against their blood pressure medication, might end up with blood pressure readings that don't make sense to them or their doctor, simply because nobody connected the dots. Acetaminophen is generally considered a safer alternative for pain relief in people on blood pressure medication, but this is always a conversation to have with your doctor or pharmacist based on your full health picture. Decongestants found in many cold and flu medications, the kind that promise to relieve a stuffy nose, work by constricting blood vessels, which can directly counteract the blood vessel relaxing effect of these blood pressure medications and cause a sudden spike. Many seniors reach for these cold medications without a second thought, not realizing the active ingredient is working in direct opposition to their daily blood pressure pill. And it's not just over-the-counter products. Certain herbal supplements, including licorice root, ginseng in high doses, and some weight loss or energy supplements, have documented effects on blood pressure that can interfere with these medications. The golden rule that protects you from all of this is simple. Before adding any new over-the-counter medication or supplement to your routine, even something that seems harmless, run it by your pharmacist. Pharmacists are one of the most underused resources for catching these interactions before they become a problem. Now let's talk about what doctors call sick day rules, because this is a concept many seniors have genuinely never heard of, despite how important it is. When you become sick with something that causes vomiting, diarrhea, or significantly reduced fluid intake, especially combined with a fever, your body becomes dehydrated much faster than usual. For someone taking Losartan or Lisinopril, dehydration combined with these medications can put unusual strain on the kidneys because both reduced fluid volume and these medications affect kidney blood flow through related pathways. In some cases, doctors recommend temporarily pausing certain blood pressure medications during a serious bout of illness involving vomiting or diarrhea until you're able to eat and drink normally again. This is absolutely not something to decide on your own without guidance, but it is something every senior on these medications should discuss with their doctor in advance, so you already know the plan before you're sick and not thinking clearly. The same caution applies during extremely hot weather. Heat causes your body to lose fluid through sweating, and combined with blood pressure medication, this can lead to a more dramatic drop in blood pressure than expected, increasing the risk of dizziness, weakness, or fainting, especially in seniors who may not feel thirsty even when their body genuinely needs more fluids. Here's another point that deserves serious attention, and that's the danger of stopping these medications abruptly without medical guidance. It can be tempting, especially if you're experiencing an uncomfortable side effect, like the swelling from amlodipine or the cough from lisinopril, to simply stop taking the pill on your own and figure you'll mention it at your next appointment. This is genuinely risky. Suddenly stopping blood pressure medication can cause your blood pressure to rebound, sometimes climbing higher than it was before you started treatment, putting you at increased risk for a hypertensive crisis, stroke, or heart complications in a very short window of time. If a side effect is bothering you, the right move is always to call your doctor's office, describe what you're experiencing, and ask whether the dose should be adjusted or the medication changed, rather than making that decision alone at home. Let's talk about monitoring, because this is where prevention truly happens. Many seniors think that once their blood pressure medication is prescribed, the job is done, and they just take the pill and move on with life. In reality, ongoing monitoring is what catches problems early, before they become emergencies. This means regular blood tests to check kidney function and potassium levels, particularly important for anyone on Losartan or Lisinopril. It means periodic blood pressure checks, not just sitting down, but ideally checking your blood pressure both sitting and standing occasionally, since this is how orthostatic hypotension gets caught before it causes a fall. If you have a home blood pressure monitor, and honestly, every senior on these medications should have one, take your readings around the same time each day, write them down, or keep a simple log, and bring that log to your appointments. This single habit gives your doctor far more useful information than a single reading taken in a rushed office visit, and it can reveal patterns like blood pressure that's well controlled during the day but dipping too low at night that would otherwise go completely unnoticed. Beyond the medications themselves, there are everyday lifestyle factors that genuinely amplify how well these drugs work, and most of them are simpler than people expect. Reducing sodium intake makes a measurable difference, and this means paying attention not just to the salt shaker, but to the hidden sodium in canned soups, deli meats, and frozen meals, which often contain far more salt than people realize. Staying consistently hydrated, within whatever limits your doctor has set for you, helps your kidneys and blood vessels function more predictably alongside these medications. Gentle, regular movement, even a daily walk, supports healthy blood vessel function, and can sometimes allow your doctor to use a lower, gentler dose over time. And limiting alcohol matters more than most people think, because alcohol can interact with these medications to cause a more pronounced drop in blood pressure, increasing dizziness, especially when combined with the orthostatic hypotension risk we talked about earlier. If there is one message I want you to walk away with today, it's this. These medications, Amlodipine, Losartan, and Lisinopril, are not something to fear, and they are doing genuinely important, life-protecting work inside your body every single day. But medication works best as a partnership, not a blind routine. Know the signs your specific medication might cause. Move slowly when you stand up. Be cautious with grapefruit, salt substitutes, pain relievers, and cold medicine. Have a sick day plan with your doctor before you actually get sick. Keep up with your lab work and your blood pressure log. And never ever stop taking these medications abruptly without talking to your doctor first, even if a side effect is bothering you. The seniors who do best on these medications aren't the ones who never experience a single side effect. They're the ones who know what to watch for, speak up early, and stay engaged partners in their own care rather than passive pill takers. This video is meant for education and awareness, not as a replacement for advice from your own doctor or pharmacist, who knows your full medical history and can guide decisions specific to you. If you found this helpful, please consider sharing it with a parent, a grandparent, or anyone you know who's taking one of these medications, because so much of what we covered today simply isn't explained clearly enough during a typical doctor's visit. If you want more videos like this, breaking down exactly what seniors need to know about the medications they're taking every day, make sure you're subscribed and let me know in the comments which medication you'd like us to cover next. Take care of yourself, stay informed, and I'll see you in the next video.